Well, hello and welcome to Momcology's Caregiver Lounge. I'm excited to welcome you to this space of learning and support. Today, I have with me Mikey Pariseau from Nemours Children's Health, and we're going to be talking about the topic of sibling support and how to care for the needs of all of our children when one of them has been diagnosed with cancer. My name is Megan Wohlers. I am from Soldotna, Alaska. I've been a member of Momcology for about a year now, but I've been walking this pediatric cancer journey since August of 2024. My favorite feature of Momcology is the virtual coffee breaks. And being from Alaska, that means that they start at 6 o'clock in the morning. But I will tell you that it's worth it to me to sacrifice some of my sleep in order to sit in a space of compassion and profound understanding that you experience when you meet another mom who's walking a similar road. I know a little bit about this topic because I'm the mom of three sons. My youngest was diagnosed with leukemia when he was 15. And to complicate an already difficult journey, our treating hospital was 3 hours from our house, which meant that for the first 11 months of treatment, we were only allowed to come home on select weekends. This left his brothers at home with their dad, who worked 12-hour shifts, sometimes on an offshore oil rig. My oldest had recently graduated from high school, but he experiences FASD and autism, and he needs a lot of daily support. My middle son had just begun his senior year, and this left him to navigate school, his sports, and his life independently. This felt like an impossible situation for our family. My child with cancer is now 17. He's in cycle 3 of maintenance. And despite all of the little things that come along with being in active treatment, he's doing well. I'd like to formally introduce you to our guest. Dr. Mikey Pariseau is a pediatric psychologist and assistant research scientist at Nemours Children's Health in Wilmington, Delaware. She received her PhD in clinical psychology from Boston University. She's done research on siblings of children with cancer for a little over a decade, and she also does clinical work with youth and families. Welcome.
Thank you so much, Megan. And I am so excited to be here with all of you today and to have the chance to talk about siblings. I, yeah, I really loved kind of what you shared about your background. I think it really highlights why it can be so complicated to think about how to support siblings when you're also thinking about how to best show up for the cancer patient. And yeah, I think that there's a lot of different things to think about, and I'm just excited to get to go into some of this today. As Megan said, we're going to be talking about supporting siblings of pediatric cancer patients. And this is a little bit of a roadmap just to go over some of the things we're going to talk about today. So we will start by talking about siblings' experiences and common emotional reactions in response to the cancer experience. We'll also go over some strategies that parents and families can use to support siblings. And then we'll also talk about some sibling-focused resources and kind of give information about kind of next steps that you all can take to get connected to some of those organizations if you are not already hooked in. The information that I'm going to share today is based on a few different things. It is informed by my research. As Megan described, I have done research on siblings of kids with cancer for a little over a decade. And my research mostly uses a qualitative approach. And so what that means is that I do in-depth qualitative interviews with siblings and parents to really hear about what it's like to be a sibling of a kid with cancer and what their support needs are. So some of the research and kind of recommendations that I'll be going over today is really informed by what I've learned from those families. And so just wanted to take a second to really thank them for helping advance our understanding of how to best support siblings. Throughout my presentation, you will sometimes see little quotes from some of the siblings that I have gotten to know through my work. I do my best throughout the presentation to really summarize, things I've learned from siblings as well as from parents. But I think that sometimes it really just kind of brings to life what we're talking about to also include it in siblings' own words. The information that I will share is also based on my clinical experience. I am a psychologist and I do work with children and adolescents and families. And I do have specific expertise in helping facilitate groups for siblings of kids with cancer. And the information is also informed by the evidence-based clinical recommendations about family-centered care. Um, and and within this, I also really want to emphasize that while I bring to this talk expertise based on my research and clinical experience, as you're listening to the things that we'll go over today, I want you to remember that you're the expert in your family. And so there might be, some recommendations I talk about that you kind of feel like, yeah, I can definitely picture doing that, with the kiddos in my life. Whereas others might not feel as relevant for you. And so I also just encourage you to trust that you know what's best for your family. Throughout this presentation, I am going to use the term patient to refer to the child or adolescent diagnosed with cancer. And I'm going to use the term sibling to refer to the sibling of the patient. I do this to help us avoid kind of confusion as we're thinking about this topic. Um, but I want to acknowledge that these are really imperfect terms, and that, both the patient and the sibling, they are so much more than just those labels or those identities. Um, so I just think that's important to keep in mind. All right, so kind of jumping into thinking about what it's like to be a sibling. And I think that it is really helpful to think about the various systems that siblings are embedded within and the changes or stressors that might be happening within each of those systems. Because for siblings, the cancer experience often means coping with worries about the patient's health, but it also means coping with changes to their daily lives, to their routines, and their support systems. And so I really like this visualization because I think it really kind of highlights, we think about the sibling here in the center, and then their kind of immediate circle is their family system. And there might be, changes happening within that system. We have the things that are going on in the treatment setting. And then we also have, the other systems that siblings are involved in, whether that's school or extracurricular activities or family friends. And so first kind of thinking about some of the things that siblings are adjusting to within their family. Um, During cancer treatment, siblings are often adjusting to changes in family roles and routines. That might be that the parent who has been their primary caretaker is now needing to spend extended periods of time at the hospital and is not able to spend as much time with them or kind of dedicate as much attention. And so kind of siblings adjusting and making sense of some of those changes within their family. Siblings also experience changes in some of their other settings, and we'll get into kind of some more of these examples, but to highlight a few, siblings might have changes to the activities that they're participating in. For example, parents needing to drive back and forth to the hospital might mean that parents are not able to be taking them to after school programs that they used to participate in. Siblings also might be experiencing that, at school, with family friends, with extended family, any of the other people in their lives. People might be coming to them with lots of questions about how the patient is doing. Siblings also might be receiving less school support while their parents are needing to be focused on the patient. Whereas before the cancer diagnosis, a parent may have spent like dedicated homework time with that sibling. That might not be possible anymore. And so the cancer experience is really associated for siblings with pretty widespread changes across the different areas of their lives. Some of the common emotions that siblings can have, I've kind of highlighted on this slide, and this is definitely not an exhaustive list. I put these out there more so to kind of emphasize that siblings can experience really intense feelings, and their feelings can be really variable from one sibling to another. Some siblings might feel really scared or worried or anxious. They might learn about the cancer diagnosis and feel really worried about the patient dying. They might feel anxious because they don't feel like they understand exactly what's going on at the hospital, or that they don't understand what's going on with some of the patient's treatment side effects, like hair falling out, or kind of noticing other physical changes. Siblings can often feel really sad. For example, they could feel sad seeing the patient not feeling good. They could also feel sad related to missing their parents. Guilt is also another big one for siblings. Some siblings worry that it's their fault that the patient got cancer. That comes up the most in kind of school age kids that have a bit of that like magical thinking, or difficulty kind of understanding the difference between like causation and just things like co-occurring at the same time. Like, for example, I can remember multiple siblings I've talked to that have described, I got in a fight with the patient, and then the next week they got cancer. So that must mean that I caused it. Um, and so, yeah, they can have really kind of big feelings or worry that maybe they did something that resulted in their brother or sister getting sick. They can also feel guilty about the fact that their brother or sister is sick while they are healthy. They can experience kind of guilt popping up when they're having fun or when they're laughing because they feel like their brother or sister isn't getting the opportunity to do those things. Some siblings also feel really angry. They can struggle with feeling angry at God or kind of any sense of spirituality that they have, and kind of grapple with questions about, why did this happen? How did this happen? They might feel mad about the fact that they have to take on more chores or other responsibilities at home. They can feel angry at the patient sometimes. The time that I hear this described the most is siblings describing that it's really hard during like steroid weeks. So weeks when patients are on steroid medication, which can make them a bit more emotional, and that can be really hard. Siblings can also feel angry at parents for not being able to show up to their activities. Jealousy is another really big one. They can feel upset about people paying more attention to the patient or the patient getting special gifts. They can feel left out when they're not included in things that are happening at the family, or lonely related to not having as much time to spend with the patient, or maybe changes in whether their friends are allowed to come to the house, or other things like that that impact kind of their peer social network. And lastly, embarrassment can come up for some siblings. I have heard particularly like teenage siblings who kind of tend to be more focused on like, are they fitting in with peers? but teens describe that it can be kind of embarrassing or anxiety provoking when they're out in public with the patient and people stare, kind of worries about people thinking that they're different. And also siblings feeling embarrassed when sometimes they don't know how to answer people's questions because maybe they don't really fully understand what's going on with the diagnosis and treatment. So these are kind of some of the common feelings that can come up for siblings. In terms of common behavioral reactions, they can again be really variable. I think the biggest thing that I tend to encourage parents to be on the lookout when it comes to behavioral reactions is really looking for changes. If it feels like in some domain, whether it's kind of emotional functioning or school, or that it seems like the sibling starts to be doing really differently, that I think that that's something really important to pay attention to. In particularly younger kiddos, this can look like going back to old behaviors. So even if they had kind of mastered certain developmental milestones, maybe regressing a little bit in terms of things like bedwetting or thumb sucking, um, wanting to be with you all the time, kind of clinging to your leg sort of energy. Alternatively, being kind of withdrawn or quieter. Some siblings tend to have kind of more like somatic symptoms, physical symptoms of their emotions. And so we would see things like headaches, stomach aches, nightmares, and trouble sleeping. Other siblings might seem like they're really overwhelmed in a way that um, they didn't used to be kind of before the cancer diagnosis. We can also see that some siblings have a really hard time in school. And some of this can be related to kind of inattentiveness and difficulty focusing at school because they are kind of caught up in thoughts about, how the patient is doing or wondering about what's going on at the hospital. And so looking out for, is the sibling getting worse grades in school? Or are teachers reporting that the sibling seems to be really struggling when they're in that setting? We can also see an increase in emotional outbursts and kind of acting out. And then I think something important for parents to kind of have on their radar too is that um, sometimes siblings are going to try to not have you know that they're struggling. I think something that I hear from a lot of siblings is, I know that my parents were already overwhelmed, and so I didn't want them to have another thing to worry about. Um, and so that can sometimes look like them not asking for what they need or kind of almost trying to act as if things are perfect and that they're totally fine. And so that can make it really hard to know quite how siblings are doing. Um, we also know that some siblings can experience what's called cancer-related post-traumatic stress. And I'm not sure quite how familiar people are with this, but cancer-related post-traumatic stress is kind of a group of symptoms that can be experienced by patients and parents and other loved ones. But they are kind of symptoms related to the cancer experience. And so these symptoms kind of fall in a few different categories. So we have like arousal symptoms, which would be things like startling easily, being a little bit more irritable, trouble sleeping, re-experiencing. So having kind of intrusive thoughts about cancer, having nightmares about the cancer experience, and then avoidance. So, wanting to avoid thinking or talking about cancer, wanting to avoid people and other places that make them think of the cancer. And I think it's really important to highlight that these symptoms, are really normal in the short term. Most families experience at least some of these symptoms initially. And so in that like first month after diagnosis, or maybe, if there's a particularly stressful period beyond that, like during treatment, it's normal for some of these symptoms to pop up. Where we kind of start to worry is when these symptoms continue for a prolonged period. And what's interesting that has come out like more recently in the research is that somewhat surprisingly, siblings actually seem to experience cancer-related post-traumatic stress symptoms even more often than patients do. And I think initially this feels surprising because it's almost like, the stressful thing isn't necessarily happening to the sibling, it's happening to the cancer patient. But I think it actually makes a lot of sense because siblings do, have exposure to those really big worries and, receive information about the cancer. And so they have that like initial crisis. But then they also tend to move through the cancer experience with kind of less information, less control, and often less support. And so I think some of that is why we do tend to see more cancer-related stress for siblings. One thing that can be really helpful is being aware of the situations that come up during cancer treatment that tend to be the scariest for siblings. And having these on your radar can be really helpful because then like, okay, these are times when the sibling is going to need a little bit more support. The times that kind of consistently siblings describe feeling some of that like distress and feeling scared are around like initially learning the cancer diagnosis, seeing the patient in the hospital for the first time, seeing visible symptoms. So this would be things like hair loss, weight loss, vomiting, fatigue. So things that they can kind of witness with their own eyes, changes that are happening to the patient. Watching or hearing about medical procedures, seeing or hearing about medical emergencies, like the patient needing to go to the emergency room in an unplanned way, and also seeing other young patients in the hospital or clinic. And these are kind of two quotes from some of the siblings I've gotten to know, really kind of highlighting this. So one described, when he was diagnosed, I was quite scared of what would happen to him. Like, would he be around for much longer? And another sibling, she's my big sister, like my role model. She had always been super active. She loved to swim. She was really big into volleyball. And then she went from doing that to being in a hospital bed and her hair falling out. And so those experiences, feeling really scary to siblings initially. Okay, so we've just gone through kind of some of the difficulties that can come up for siblings. And I know that those things can be kind of heavy to talk about and to think about. So what can we do to support siblings? Before we kind of jump into some of the recommendations I'm going to talk about, I think it's really important to keep in mind that we don't need to do these things perfectly. Small, thoughtful steps can make a really big difference in supporting siblings and their well-being. You don't need to do this alone. I really hope that you can think about how to involve your care team and other supportive people in your life. And lastly, that there's no too late with this. No matter where you are in the cancer journey, I think there are definitely ways to consider how to best support siblings. Okay, so first we're going to talk through some of these recommendations, and then we're also going to leave some time at the end to talk more about questions. So the first recommendation is to share honest, age-appropriate information with siblings. And what age-appropriate looks like is going to vary depending on how old the sibling is. For young siblings, really kind of focusing on keeping those explanations simple. So for example, Sammy's blood is sick. The doctors are going to give him medicine to help him get better. For school age kiddos, focusing on both giving information and also asking questions to kind of start a conversation, giving a little bit more information than you would, with a younger sibling. For tweens and teens. Um, I think in general, understanding that by that age, they probably already have some like preconceived notions or ideas about what cancer means. And so giving them information and also asking questions to kind of um, chat with them about, what do they already know about cancer? Yeah, what is their understanding of the diagnosis? What parts feel confusing? This is also an age group that is more likely to also want to like read about it and look it up on the internet and learn about it their own, like on their own. And so I think kind of equipping them with trusted places on the internet and through books that they can find some of that information is a good idea. It's also really important to be aware of some of the common misconceptions or incorrect ideas that siblings tend to have about cancer, so that you can help correct these for them. Particularly in younger kiddos, who maybe their only like concept of illness or sickness is something like the flu or a cold. They can have worries about cancer being contagious in the same way that like a cold or the flu would be. And so helping them understand that cancer is not contagious, that they can go and see the patient and they're not going to get cancer from them, or other family members aren't going to get cancer from them. Um, as we talked about before, siblings can also have incorrect ideas that it was their fault that the patient got cancer. So helping them understand that cancer is not caused by getting in a fight or saying something mean, that they did not cause the cancer. Helping siblings understand that side effects of treatment, such as hair loss or other physical symptoms, are expected, and that they're not signs that things are getting worse. I think that's one of the big things I hear when I'm talking to siblings is, they witness symptoms like hair loss, which are expected with the treatment, but that they didn't know that that was expected. And so they kind of assumed that that was a bad sign. Um, and then older siblings, as we just talked about, kind of helping them make sense of things that are, on the internet they might access. The next big recommendation is, if possible, supporting siblings to visit treatment centers. And sometimes this one surprises families. I think there can be a really natural urge to like shield siblings from the stressful parts of cancer treatment. Um, but actually, what we know from the research is that when siblings are not allowed to visit the hospital or clinic, they can actually feel more scared or confused. Kids have really vivid imaginations, and in a lot of ways that can be great. But in this specific context, when they're not allowed to go to the hospital and they're just kind of hearing little bits of what's happening there, often they fill in the gaps with actually kind of a story or information that is scarier than what's actually happening. So when we let siblings visit treatment centers, it actually helps them kind of become more familiar and comfortable with what is happening. It's really helpful to prepare siblings for what they're going to see in treatment settings before they go. So, letting them know that there's going to be machines, or, if there are certain physical symptoms that they're going to notice, or if there might be different procedures happening. And just being aware, kind of as the parent, that it's really normal for first visits to the hospital or to the clinic to trigger really big emotions. And that, I've heard some families describe that, the sibling went to the hospital for the first time, they had a big emotional reaction, and so then they decided to not have them go back. And I would actually say, sometimes when siblings have that big emotional reaction on the first visit, it's actually even more important to encourage them to go again. Because on those next visits, it's really going to help them become more comfortable with what they're seeing. Um, and sometimes in-person visits might not be possible. This was obviously a big thing that families faced during COVID and continue to face in some settings. And so if in-person visits are not possible, thinking about, are there virtual ways to help siblings get more familiar, whether that's, a virtual tour of the hospital or, asking some of the providers to introduce themselves to the siblings on FaceTime. These are some kind of quotes from siblings I've gotten to know that really kind of highlight this experience. So at first I had a weird feeling about being in the hospital, like what's going on? Is that bad? I didn't really know what was happening. The noises, the people, the medicine, I didn't like it. But then they described later in treatment, we were there and patient would get his vitals checked. Sometimes he would get medicine and I got used to it. It was just like a normal thing. We were there. So I think this really kind of highlights that the distress tends to go down over time and siblings become a lot more comfortable. And that multiple visits and really getting to know the medical team and the medical setting helps them feel more comfortable. I'm going to keep going just for the interest of time. Okay. The next key recommendation is allowing opportunities for siblings to ask questions. And one important piece of this is making sure that some of those opportunities are times when the sibling gets to ask questions when the patient is not present. Sometimes siblings want more information than the patient does about different things. Or sometimes the questions that the sibling wants to ask might be upsetting for the patient to hear some of the answers to. And so making sure that siblings kind of have separate times and spaces where they can get some of those questions answered. And as a parent, you don't have to have all the answers. I think encouraging siblings to ask questions doesn't mean that you suddenly turn into an oncologist and you have all of the information. But it, I think, creates a helpful, just kind of communicates to the sibling that they are allowed to have questions. And if you don't have the answer, you're going to help them figure that out. Some of the questions that siblings ask are going to be tough questions. A common question might be if the patient is going to die. And I think that with this, I really encourage parents to try to avoid promising anything that you can't control. And so, instead of offering reassurance such as things are going to be fine or it's all going to be okay, saying something like the doctors are doing everything they can to make sure that doesn't happen. And most kids with this type of cancer get better. But yes, it's serious, and that's why we're being so careful. I think it can also be really helpful to ask medical providers and child life specialists to help explain things to siblings. They often have cool toys, like in this picture, that they can kind of explain things in a developmentally helpful way. The next key recommendation is really talking to siblings and getting their input on how they want to be involved in cancer treatment. There are a lot of different ways for siblings to be involved, and what feels good for involvement is going to vary sibling to sibling. So some siblings are really going to want to learn more about the cancer diagnosis and treatment because that's going to help them feel less anxious and more safe. And so things like visiting the treatment centers, having opportunities to ask providers questions, those kind of things are going to feel really good to them. Other siblings might really want more opportunities to emotionally support the patient, kind of getting the chance to spend time with the patient in the hospital or bringing something to the hospital to cheer the patient up. And I give a few different kind of examples here. It might be a favorite toy or a playlist of songs, or I talked to one family where the sibling would always bring this silly news style report of gossip from school to the patient, and that felt really fun for both of them. It can also feel helpful for siblings to have opportunities to help and have a role in treatment. I think that one of the things that can feel really upsetting to siblings is that it feels like there's nothing that they can do to help. And so kind of working with siblings to find special jobs for them to help out with, which, could be something as simple as, it's their job that they go and get the snacks for everyone from the hospital cafeteria. Or it might be, talking to the medical team and actually figuring out kind of a way for them to be involved in the medical care. Like I connected with one family who had the sibling be the one who turned on the switch for the patient's stem cell transplant. Um, Other siblings are mostly interested in just finding ways to be together as a family. And so I think things like planning activities at the hospital, whether that's a family movie night or having a little birthday party at the hospital, can be really helpful. And those are definitely things to ask your care team for help with planning. And so, kind of knowing that there are a lot of different ways that siblings may want to be involved in cancer treatment, I really kind of encourage you to not make assumptions about how siblings want to be involved, but to ask them. One of the biggest things that's come through in some of my research is that parents sometimes don't know that siblings actually want to be more involved. And so, kind of having that opportunity to really hear from them, like, how do you want to be involved? Would you want to visit the hospital more? Like, what would you want to do there? Those conversations, I think, can be really helpful. And also revisiting those conversations over time, because preferences definitely do change. And you are not always going to be able to totally align how siblings are involved in treatment with what they want. And that's okay. I think the really positive thing that also came through with our research was seeing that even when families couldn't align with how siblings wanted to be involved, so, if a sibling wanted to visit the hospital every day after school, for example, like that might be a really hard thing for the family to accommodate. But even just having that conversation and the sibling having the opportunity to express what their preferences are, those things do, or those conversations rather, do a lot in terms of helping the sibling feel included and seen in the cancer experience. And then you have the opportunity to kind of brainstorm and problem solve. Like, okay, maybe we can't make daily visits to the hospital possible, but could we have the sibling do a longer visit on the weekend? Or if they're just really missing the patient, could they have, daily FaceTime calls after the sibling's done with school? But having those conversations really kind of allows you to problem solve. The next recommendation is really making space for all feelings. And this can be a really tough one. I think it's really important to tune into, what messages are siblings hearing about emotions, and specifically, like, are they hearing messages that let them know that only some emotions are okay for them to express? I think it's really common and makes a lot of sense that when a family is adjusting to a cancer diagnosis, there can be a lot of messages from people inside the family, outside the family, about staying positive and being strong. And those messages, like, absolutely have a place. But we also want to make sure that siblings don't feel like they need to bottle up their negative emotions, that they know that it is also okay for them to feel scared and sad and angry. And I think as a parent, you can encourage this in a few different ways. I think explicitly letting them know, it's okay to feel scared and sad and angry and jealous. Letting them know that a lot of siblings feel that way. I I think you can model healthy emotional expression of tough feelings. So kind of tuning into, okay, whenever I'm around the sibling, am I kind of putting on a brave face and smiling and saying that everything's fine? Or there may be opportunities for me to say to them, like, this is really hard. I know we're going to get through it, but some days I feel really sad. Um, because when you model those emotions, it's going to help them feel like it's okay for them to also have those feelings. Um, and creating frequent opportunities for siblings to share their feelings with you and with other trusted adults. And I think, there are lots of different ways for siblings to express their emotions. Some of them might be really open to kind of like a one on one talk sort of discussion. Other siblings are going to have a harder time with that. And so I think also providing some suggestions for them of like other ways that they could express how they're feeling, whether that's writing out their feelings in a letter, that maybe you and them pass letters back and forth about how you're feeling, or encouraging them to draw or paint or use kind of other forms of emotional expression. And I think for parents, it can sometimes be really hard to hear how siblings feel, because you already have so much on your plate and you have your own emotions and you have the cancer patient's emotions. And sometimes, yeah, it can feel like a lot when the sibling is also then expressing to you that they feel jealous or that they feel lonely or angry. And so I think having a plan can be really helpful, and kind of steps in your mind so that when the situation comes up, you're like, okay, I know what I'm supposed to do. Um, First, I think it can be really helpful to focus on, okay, I'm just going to try to actively listen, kind of without responding. I'm going to put my phone down. I'm going to look at them and just try to hear what they're communicating to me. Next, really being mindful of your own reactions, like what comes up for you. Do you feel angry? Are you wanting to jump to problem solving? And I think it can be helpful to first like take a breath and just focus on the emotion that they're sharing. Not if you think they should be feeling that way, not how to fix it, but just, okay, what is the emotion that the sibling is trying to express to me? Um, and then really focusing on just reflecting back to them, what they're sharing with you. And the goal here is really to help them feel heard and understood. Um, so this might be saying back to them, it sounds like you're having a tough time right now. Thanks for telling me how you're feeling. Things are really stressful right now. So it makes sense you're feeling that way. Or I understand why it's hard for you when Jake gets presents and you don't. That wouldn't have happened before his cancer. And I hear you that it feels really unfair. So just really kind of focusing on like reflecting back what you're hearing. And an important thing here is like when we validate emotions, that doesn't mean that we agree with those emotions. It means we understand how they feel that way. And we know that validation helps strong feelings settle. Like when someone tells you, like, oh, tries to convince you not to feel a certain way, that kind of makes people, it's almost if you picture like a tug of war, makes people dig their feet in more. But when someone validates what you're feeling, like you kind of relax. And so that's kind of our goal here. And we know that validation really strengthens relationships. And we do want to encourage siblings sharing their feelings with you. An important note here is also making sure that you have times and spaces to process your own feelings, whether that's about siblings' feelings, whether it's about what's going on in the broader kind of cancer experience, but making sure that in the same way that you are actively working to provide that space for siblings, that you also have that space in some other relationship. The next piece is kind of thinking about making space for feelings and bereavement. I think it's really helpful for families moving through bereavement to know that siblings might grieve in ways that you don't expect, or ways that are different than how you're grieving. And just kind of having some awareness of that, I think can really help with validating siblings' emotional reactions, and knowing that kind of their reaction is valid and it makes sense. Some siblings are going to find it helpful and need to talk about it and share big emotions, while others are going to have a harder time at first. Some are going to feel guilty or confused. And some siblings, it's going to feel, especially initially, like, you know, that they're only really focused on themselves. And this is one that I've heard from families that can feel really confusing and upsetting to parents. And so I think it's really important to highlight. And it actually makes a lot of sense. I think that um, often, kind of in moving through grief, it can feel important to make sure that our own needs are being met, for attention, for emotional security, for lots of other things, before we kind of feel safe, in order to move into that space of actually grieving and feeling our bigger feelings. And so it might feel like, kind of, especially initially, that siblings might be acting in a way that feels kind of confusing. And so just kind of putting that on parents' radars. And then, kind of, our last recommendation, is really thinking about helping siblings take a break from cancer, that it can be really wonderful for them to feel included and involved in the treatment experience. But we also know that for some siblings, it can feel like their whole life starts to revolve around cancer. Um, for example, during cancer treatment, it might feel like there's lots of talk about cancer, and cancer treatment at home. There might be a home nurse visiting or treatment supplies around. Um, I've talked to siblings who they share a bathroom with the patient. And so once the patient is out of the hospital and at home, but still having a lot of symptoms, they might be getting kind of exposed frequently to the patient throwing up, which can be difficult for siblings. Some siblings take on a lot of extra responsibilities. As we mentioned before, teachers and other people might be asking them frequently about how the patient is doing. When siblings are at school, families have all different systems for how they're communicating updates. And I've talked to some siblings who kind of get email notifications, about how the patient's doing. Some siblings, might stop doing activities that they care about, because the family is struggling too much. So I think some of these examples just kind of highlight how it can kind of feel like cancer is like taking over everything. So some examples of kind of ways to help siblings take breaks, depending on what areas, it feels like they're kind of not getting that space. If there's lots of talk at home about cancer and that feels upsetting to the sibling, this could be deciding that 10 minutes of family dinner will be like a no cancer talk zone. And that you'll talk about something kind of fun, or also just making sure in general to also generally be asking siblings about other things going on in their life, so that they don't feel like those are kind of pushed to the side. If increased responsibilities are feeling really hard, maybe this is problem solving with the sibling around, okay, what is the task that you really don't like doing? And then trying to find another strategy for getting that task done that is not the sibling doing it. Or if they really miss certain activities, maybe it's brainstorming ways to help them get more engaged with those activities that they're missing, like having someone else give them a ride, or even considering like public transit for older siblings. So these are just kind of some examples of thinking through what this might look like in terms of helping kiddos take a break. Oh, and then the last one of like, if the sibling is having a hard time focusing at school because they're often thinking about cancer, trying to think of, okay, are there some boundaries we could set around the school setting? Like maybe it means the teacher doesn't ask them about how it's going at the hospital. Maybe that kiddo doesn't get those email notifications while they're at school. But again, like really kind of talking with the sibling to feel out what feels right for them, because this tends to vary sibling to sibling. But in general, I think kind of having these conversations with siblings is really helpful in just communicating that, like giving permission to take a break and communicating to them that having time to have fun and relax really helps us get through tough things. And so emphasizing that it's important for them to have those spaces. All right. So starting to think about resources. I would always kind of encourage you to start by asking your care team. And this is because they are going to have a better sense of some of the local organizations and resources that you might be able to get connected to. The ones I'm going to go through on the next slides are kind of national organizations, which are wonderful, but there also are likely some kind of state by state resources you can get hooked into. I also kind of provide some other examples of questions that you can ask your care team, because I think sometimes there are available resources that will not be offered to families, unfortunately, unless you specifically ask for it. So asking, are there support groups for siblings? Can siblings join for patient-focused activities and events? Can the child life specialist meet with the siblings in our family? Is it ever possible to make exceptions to your sibling visitation policy? This was one that came up during COVID. It also comes up during flu season and other things. But I have heard examples of care teams making exceptions sometimes. So the example I give is, you're needing to be at the hospital with the patient, but you also have a 1-year-old. And that's hard for you to be separated from them. So kind of asking your care team, like, is it possible to make exceptions to some of these rules? Asking them if they can connect you with community therapists. Asking medical providers to introduce themselves to siblings, which we know helps siblings feel kind of more seen and included. Asking for local information about sibling supports, things like camps or other organizations. And then also asking about like financial support related to meeting family and sibling needs. Okay, and then a few specific organizations. If you are not aware of Super Sibs, I definitely encourage you to Google them and sign up. It's free to sign up. And they give a lot of really helpful information about siblings. They do mailings where they send out specific things to siblings, which I think are really sweet and helpful in helping siblings feel like seen and important. They have camps that can be attended by both siblings and patients. They give really helpful information about school support. So just a lot of really great stuff to explore through their online website. And you just kind of go in and you can sign up by entering your information. So it's all really accessible. They also have some really helpful resources related to grief, like a parent toolkit about how to support siblings related to grief. The National Cancer Institute has a really helpful guide for specifically teenage siblings. You can just download it as a PDF, or they also have it like available online, but it kind of gives information about cancer, but also has prompts for siblings to kind of think about the emotions that are coming up for them and what some of their needs might be. So I think it's a really excellent guide for teens. Brian's Case for Smiles. They have, if you go to this website, their coping space, they have specific resources for siblings, information on coping tips, a special site just for siblings, information about school support. So lots of great stuff on there too. Lastly, I get asked a lot about like, how do I find a a therapist. And so, as I said, I think ask your care team is always a great place to start because the sibling might be able to meet with someone actually within your care team, or they might have recommendations about other providers that they know and have worked with, in your broader community. But if those strategies don't work, my next top recommendation is going on Psychology Today. I think what's great about this website is you can filter based on a lot of different things. You can put in like your insurance type and where you live. And then they also have, you'll see up here, I have set the filter to, there's a chronic illness filter and there's also a cancer filter. Um, and so I think filtering based on providers who specifically have experience related to supporting families related to cancer or chronic illness, I think is a helpful one to get providers with relevant expertise. I hope these strangers feel okay with being in my PowerPoint. These are just people from where I live. All right. Um, that is all I have to share. I am excited to hear the questions from oncology members.
Yeah, thank you so much, Mikey. What a I think like the thing that kept coming to me when you were presenting is just how complex the issue is and how it's different for every family with different age siblings and everything. So there's so much to kind of think about. I'm like, wow, I could have used some of those resources when we were going through that part. But yeah, thank you so much for your expertise and sharing that with us. I do have some questions that came from Momcology members prior to this, so
Sure.
we'll kind of dive into those. One of them is I'd love some guidance on how you know whether to like nudge or force the sibling into counseling of some kind, or like how much do we just follow their lead, or how much do we push the issue? Like especially if we as a parent identify that they're struggling.
Yes, totally. And I think this can be really hard. Because I think as a parent, you're kind of trying to balance like these two different goals, right? You have one goal around making sure that siblings are getting the support that they need. And then another goal around like helping siblings feel like they have some level of control over their lives. Because I think the cancer experience, it can feel for siblings like they just kind of don't have control over things. And so like wanting to respect some of that autonomy, but also making sure that they get that support. And so I think the questions I guess I would want to ask this parent more questions about kind of how the sibling is doing. But some of the things I would consider are, you know, one, like, are there emotional or behavioral indicators that this sibling is struggling? Um, because that will kind of help us know that they need at least some sort of support, whether it is therapy or kind of another sort of support. Um, I would also kind of want to know, like, does this sibling have, like, are they talking to either the parent or other trusted adults or people in their lives about their emotions? Or does it really feel like they are kind of pushing away talking or thinking about cancer in general? Kind of as we talked about in the beginning of the PowerPoint, sometimes cancer-related post-traumatic stress symptoms can really present as um, like really kind of firm, like, no, I don't want to talk about this. And so paying attention to that a little bit. Um, I think that it's helpful to, you know, over time let siblings know that that they can meet with a therapist. I think it's great to like give that option. Um, I think it's great to like model that that's a normal thing to do. Like you can talk about that you're going to see a therapist. You can like model emotional expression of like talking about your negative or tough feelings about the cancer experience. I think all of those things are going to kind of start to be helpful. And then I think, you know, I definitely have worked with some families who like try out having a sibling meet with a therapist. And the therapist goes, I mean, the sibling goes, and they just feel like, I don't think this is helpful. I don't want to do this. And I think we can't force it. I think it's great to encourage siblings to try. But I think we can also kind of create other opportunities for siblings to talk about their feelings or kind of process some of their feelings in a way that also might feel more accessible if therapy is not feeling accessible. I think getting connected
Yeah, no.
to other
I was
like
gonna say like more
organizations,
organic, a more organic
totally.
way to process that feeling. So yeah, that makes a lot of good sense.
Yeah,
Yeah,
absolutely.
I know for my son, I checked in with his sports coach because I was like, hey,
Yeah.
I need to like really impress upon you that you're spending way more time with my child than I am right now. And so
Hmm.
like if you could check in with them, and
Yes.
that was really helpful.
I
So
love that. Yeah, I just want to like emphasize that as a comment because I think I love when I hear parents share that they're like letting people know, yeah, we're moving through this period. I'm really focused on what's going on at the hospital. You're spending more time with my kid. I might not notice some of these things. Like work with me. Like help me have
yeah.
eyes on how this kiddo's doing. Like be there if they want to talk about it. Because I think it's that kind of like community support that is really helpful. And yeah, coaches are great people to loop into that.
Yeah, I also put a PSA out to like other parents. Hey, when my kid is, in his sports race or whatever, can you please take a video or something and send it to me? Which
I
helped me
love
to loop
that.
back around to my kid to say, hey, I saw you finish your race. What a great finish, and that kind of thing. So I
Yeah,
think, yeah, some of that organic support is just as important as maybe a professional. That's good.
totally. I love that. I love that.
Um, so another question kind of that came to us was, like as parents, how do we handle the it's not fair from like both sides of that equation? Like we have the it's not fair from the sibling who's like, wow, my sibling with cancer is getting all of this attention, but then vice versa, the child with cancer also is like, hey, I'm missing out on these fun things that they get to go do. And so we kind of have this like idea that it's not fair from either side of that coin.
Totally. Yeah, I think this is a big one. And I think it can be helpful to like kind of going back to like the instructions we talked about like validating emotions. I think in large part the same things apply here. I think it's helpful to like acknowledge the feelings that you're hearing from both of them. Like it makes sense they both feel like this isn't fair. In a lot of ways, it's not fair. I think trying to avoid getting into like convincing them they shouldn't feel that way or doing any sort of like comparison of, no, it's not fair because your brother or sister had to do this or that. That any time that we are kind of trying to convince someone to not have a feeling that they are actively having, it's gonna do that kind of tug of war sort of feeling of like digging in even deeper to feeling that way. I think, especially with like these emotions that I think can be hard for parents to hear. It's hard to hear your kids say like, "This is really unfair." Trying to just kind of go back to, yeah, like acknowledging, thank them for letting you know they're feeling that way, because we do really want to encourage siblings to be sharing their feelings. And and I do think that there can be some things that parents do, like kind of on the back end to try to like prevent if there's common triggers for these feelings coming up. Like, I think it can be helpful, like if a sibling is repeatedly getting upset that the patient is getting like toys and other things, I think it's totally reasonable to kind of, yeah, tell people in your life, like if you're going to be bringing something for the patient, it'd be really helpful for us if you also brought something for the sibling. Um, or, if the patient is feeling jealous of things that the sibling is getting to do, like thinking about, okay, are there opportunities for the patient in the hospital to do things that feel like developmentally appropriate and not related to cancer? So, like, one I love is there are like virtual opportunities for kids to take like art classes. And that could be something that feels like not related to their cancer identity, but just kind of like a normal activity for them to do. So I think, yeah, I mean, I think you can kind of try to brainstorm like, are there ways for me to avoid some of these common triggers? But also, like, the reality is you can't prevent everything. It's an unreasonable
Yeah.
expectation on a parent to be able to like create a situation where no one feels like it's unfair. They are going to feel like it's unfair because it is unfair. And so just kind of being able to sit with them in those feelings.
Yeah, I think you touched on something that was like, yes, like in your comment there with when you're saying like you can ask other people, hey, if you're going to bring something, can you also bring something for siblings? I
Hmm.
feel like that's such an important um like mention of empowering the parent to say you get to decide how other
Totally.
people will also interact with your family. I
Yeah.
think that kind of leads into one of our other questions, which is like, do you have any advice on dealing with educators and neighbors and community members? Like, especially, I think about my teenagers who were home and out in the community without mom or dad frequently, and people would say, "How's your brother doing?" Or, like that. Like, do you have any advice on like setting boundaries with the community to say, hey, when it is and is not okay to, ask questions or in what way?
Yeah, totally. I think some of this, I think kind of gets back to, I think it's really great to like talk to siblings to feel out like what feels good for them. And because yes, there are definitely siblings I have worked with and gotten to know that really hate it when people are just always like the only thing that they ask them about is how the patient is doing. I think this does come up the most in teenagers, and I think that makes a lot of sense from where they are like developmentally. Like if we think about kind of the normal like developmental tasks that go along with any age range, teens are really focused on it's kind of like separating a little bit from the family and like really forming their own independent identity and exploring their activities and like this independent sense of self. And so when they're moving around the world and every person they're interacting with is not asking about that sense of self, they're asking about the patient, I think it can bring up really complicated feelings for them about like, okay, who am I outside of being the sibling to Sally? Or, so I think it's totally reasonable to talk to siblings about that and see if they want your help with establishing those boundaries. And so that might look like, yeah, you communicating to people. Some siblings might feel up for, depending on how old they are, like setting those boundaries themselves and just kind of, you could equip them with language around how to say, I know that you're asking because you care and you're trying to express that you care, but would it be okay if you didn't ask? And I know that I can come to you if I want to talk about it. But it's actually helpful for me to also have spaces where I don't talk about it and I get to take a break.
Yeah. Yeah, so good. And also like such great just like information for how you deal with people in the future in this setting or outside of this setting, right? Like it's okay to set
Totally.
boundaries about what you're going to talk
Hmm.
about. Like that's so great for kids to learn early on. So one big question that like came up was how do we address our parent guilt? How we feel over spending more time with the sibling with the cancer versus without, that just is something that automatically comes along, right? And we often don't have control over it. But like, what do you have advice for us parents about how to deal with the guilt?
Yeah. Um, I'm so glad that this question was submitted because I think it's just really important first, like for parents to know that you are not alone in having these feelings. Yeah, over the years have talked to a lot of parents like across the United States. And I feel like every parent I have talked to um, has expressed like in some way that they feel like they let the sibling down during cancer treatment. And that makes sense because it is an impossible task to do what's needed for the patient during cancer and also show up as a perfect parent to the sibling. Like you just actually can't do both things because you don't have two versions. Like you can't physically be in two places at once. And it makes sense that your brain is focused on cancer treatment because that is the immediate risk. And that's how our brains are wired is, if a bear ran into this room, I would stop paying attention to what was going on my TV screen because the bear would be the immediate risk. And so I do think it's helpful, like first, just to acknowledge that this is an impossible task, and you are going to let siblings down, not because you are a bad parent or because you have failed in some way, but that is what the situation is, unfortunately. And I think there can be in our society, especially like so much blame on parents and particularly mothers, I think, around like if your kiddo is struggling in some way, then you have done something wrong as a parent. And I think in this situation in particular, that's just not the case. And so I really try to encourage parents that I work with to try to kind of get to a place of like being able to hold two things to be true at the same time. So, like, one, I'm doing my best in an impossible situation. And two, that the sibling is struggling because I'm not able to be there for them as much as I used to. And that's not your fault because, again, like you are doing the best in an impossible situation. Um, but I think being able to kind of connect to those things is a really important first step in supporting siblings because um, I think that when parents kind of don't like necessarily have the space or the time to like sit with and acknowledge that like of course they're feeling this way. Um, I think it can be easier to kind of when siblings are expressing that they're struggling, like be quick maybe to jump to a place of like defensiveness or because it's hard to kind of recognize. And so I definitely think it's helpful. I mean, one, like to connect with other people that have gone through similar experiences. I love Momcology. I think it's an incredible example of that. One, to kind of know that you're not alone in these feelings, but also just it's naturally for us like a lot easier to give compassion to other people. And so I think like in making friends who have similar experiences, like I think you'll notice yourself like having compassion when they describe what they're feeling about like parent guilt. And I think it can be easier to kind of first have that compassion for someone else and then kind of translate it to yourself. But yeah, so those are kind of
Yeah.
some of the thoughts that come up
No,
for
I
me.
really like that. Like practice on someone else. If if
Yeah,
this friend going through what you're going through, like what advice would you give them and then take it yourself? Yeah, that's so good.
yeah.
Do you have any final thoughts for us or anything else you want to,
I
something
don't
that I
I don't
didn't
think
ask that
so.
you might want to answer? Yeah.
I don't think so. Yeah, those were really great questions. And it was really wonderful getting the chance to join you all today. This was great.
Yeah. Well, thank you so much for joining us and sharing your expertise. And thank you for the research that you do and the work that you do with families. It's really, really important and it's certainly valuable to those of us in the parent, situation here. I just want to say thank you to our viewers of this program. We hope that you found it educational. We hope you found it supportive. And I will say my only regret about Momcology is that I didn't find it sooner in my journey. So I hope that you jump on one of our virtual coffee breaks soon and that I get to see you in person. So thank you so much.